Let's talk to Dr. Layla McCay. She's director at the NHS Confederation. Good morning to you, Layla.
Good morning.
Good morning. Really big concerns here, and this after, of course, we released our lockdown rules for pretty much most of the country, other than odd spikes in Leicester and Oldham. Now we're seeing overtaking Leicester, but we've basically been following what the Europeans are doing, going into the lockdown after them and coming out of the lockdown after them. Learning the lessons is the idea, but it does seem that the lesson to be learnt from large parts of mainland Europe is that there may well be an increase in cases to come. How concerned are you at the NHS Confederation that we could be heading into a second wave?
I think that we're all very concerned. Obviously, this is a new virus. We don't know how it's going to behave. We don't know what's going to happen coming into winter. But we can assume from looking at other countries around the world that a second spike is absolutely a risk. And as we come into winter, which in some ways is a more challenging time, and we're coming in having reduced all these various precautions we may have previously been taking, it certainly looks like a risk. And we can't forget that just a couple of weeks ago we heard from the Academy of Medical Sciences that there could be 120,000 deaths from coronavirus this winter. I mean, that's not the likely scenario, but it's still a very worrying one.
No, but again, that was a scenario if we took no mitigating measures whatsoever. And again, that's the thing when we were talking about the Imperial College very early on, in February and March, about 250,000 deaths from coronavirus. Again, that was if we didn't even forget lockdown, we didn't even do any social distancing and wash our hands. So we have to look at what people reasonably doing. But it seems to me when I move around, I mean, certainly I've just flown back from France, and people in the airport, people in on the plane, people when I go out and about and I'm on public transport. I was in a hotel bar yesterday. People are exercising social distance. No one's shaking hands. People are staying apart. People are washing their hands, as often as possible. It seems to me that people are largely obeying the social distancing and the pandemic rules, but clearly not everywhere, because we are seeing this wave. There does seem to be some concern. World Health Organization I mentioned earlier, that it's young people driving the spike. They don't feel they're at risk because basically they're not, and they're going out partying. We see all this footage from America where it's just being widely ignored by young people. But of course they do pose a risk in spreading the virus to other people who are at greater risk.
That's right. I mean, first of all, some young people may feel they're not at risk, but of course we know some young people do become quite severely ill and have died from this virus.
Yeah, but I mean, I think in the last couple of months, I don't think anyone in age at 30 has died. I mean, we have to be realistic. I mean, it really is a very low risk to young people.
I think that really what we're thinking about when we look at young people is the risk that they pose to their loved ones and to their communities. If they're out, they happen to catch the virus, and then they're home and they're hanging around with their friends, their family, their older relatives. There is this risk of putting other people at increased risk of developing coronavirus, and that is what the World Health Organization is so worried about at the moment, as we're seeing young people out and about.
Yeah, I mean, that's the thing. We are seeing people more out and about. I mean, that said, not out and about enough to boost the economy. Lots of people still working from home, and yet out and about socialising. It does seem to me, could we stop the socialising and all just get back to work? That would be a better, perhaps a better route for our economy. The reports, though, suggesting that the R rate is increasing. That in 4 out of 7 English regions we've seen it rising here in the UK. Whereas for months we've seen it just slowly. But that's been the case in virtually every other country where we've seen the pandemic. Is that you get a very high, sharp uptick, and then you see this very long, slow route down. But it's believed now to be above 1 in both the southeast and the southwest of the country. Bearing in mind the southeast was the first to get the coronavirus, and long since been pretty safe. Southwest barely been hit by coronavirus at all. This is a concern, because this is what we're seeing even in countries like Germany that have been very successful dealing with the pandemic, is that they're seeing a really quite a statistically significant rise in the number of cases.
That's right. I mean, it can't be surprising that as we've all been obeying all sorts of lockdown restrictions, those have been eased. People are socialising. It's not surprising that people are getting closer to each other and there's more transmission. But while it's not surprising, I think it's extremely worrying, and we can look to our neighbouring countries to see what sort of trends we might expect. Yeah. And when we look at that, I think that the NHS and our members start to feel anxious, because, this is a time when the NHS is working so hard to bring back all the services that it paused when it's preparing for winter. And if suddenly there is this increase, it's going to be very challenging.
Well, indeed, although we understand that Australia has had a very mild flu season. Their winter, of course, is now. And we base our flu vaccines and we're told it's going to be eligible. Everyone over 50 is going to be eligible for it this year. But actually, we've seen last couple of years some really virulent strains of flu, but they think it's quite a mild strain this year, and that's what we will usually end up getting in the northern hemisphere come winter. That is at least one encouraging sign. What do you make of the decision to extend the isolation rule from 7 days to 10 days? I mean, it's quite confusing because we've been talking about the quarantine rule, and that's 14 days. Because currently, if you come down with symptoms of the virus, we've been told you must isolate for 7 days. Anyone in your home with you, anyone you've been in contact with, should quarantine for 14 days, mainly because you could still you could actually catch the virus on the 7th day of the other person in your home catching it, and there you have to allow for that incubation period. But why now, so many months in, has it been extended from 7 to 10? Does that mean that we were wrong all along and it should have been 10, or is there new information?
I think that that's information that has not necessarily been made available, and it would be helpful to see. But if I was going to make a guess of one reason, it might be the case that we now have more testing that is happening at an earlier stage. So it might be the case that people are being diagnosed earlier, which means that 7 days in from an earlier diagnosis is not quite so far along. So it might make...
I think we may have just lost sound for you. Dr. Layla McCay, hold on. I hope we can get you back. I'm not quite sure whether you might have pressed your mute button or what's going on there, but we have still got you there. Lovely. Just one particular specific issue, travel quarantine. A big row over this, and Heathrow, we spoke to their boss yesterday, John Holland-Kay, talking about actually we need testing, and then we could perhaps cut the quarantine time down to effectively a working week rather than 2 weeks, which could be a big difference for people. But we are seeing the prospect tomorrow of more countries being added to the travel quarantine list. Do you agree that we need to have these quarantine lists, and that actually this is the way to stop the spread of the virus?
Well, I think there's lots of different ways to stop the spread of the virus, and if the scientists are seeing the evidence that this is a real risk, then certainly it is one way of dealing with that. At the end of the day, we need to find different ways to reduce the risk of a deluge of infections, and if quarantining is able to help with that, then it's something that, of course, needs to be a tool in our toolbox.
Absolutely. Well, thank you very much indeed for joining us, Dr. Layla McCay. She's a director at the NHS Confederation.